In 1847, a doctor walked into a hospital ward and started counting bodies, not because he was morbid, because something was wrong and nobody else wanted to admit it. His name was Ignaz Semmelweis. He was 38 years old. He worked at the Vienna General Hospital, one of the most prestigious medical institutions in the world. And he had just discovered something that would save millions of lives. The problem was that nobody believed him. To understand what Semmelweis found, you need to understand what childbirth looked like in 1847. Vienna General had 2 maternity wards. Ward 1 was staffed by medical students and doctors. Ward 2 was staffed by midwives. Both wards delivered babies. Both wards had the same equipment, the same building, the same water supply. But women were dying at completely different rates. In Ward 1, the death rate from childbed fever, a bacterial infection that killed mothers shortly after delivery, was between 10 and 18%. Nearly 1 in 5 women who entered Ward 1 to give birth did not leave alive. In Ward 2, the death rate was 2%. Women who found out they were assigned to Ward 1 begged to be moved. Some gave birth in the street rather than enter. They did not know why Ward 1 was deadly. They just knew that it was. Semmelweis knew something was different between the 2 wards. He just didn't know what. Then his friend died. In March 1847, a colleague named Jakob Kolechka was performing an autopsy when a student accidentally cut his finger with a scalpel. Kolechka developed a rapidly spreading infection and died within days. When Semmelweis read the autopsy report, something stopped him cold. Kolechka's symptoms were identical to childbed fever. Semmelweis made the connection instantly. Medical students and doctors in Ward 1 spent their mornings performing autopsies on cadavers. Then they walked directly to the maternity ward and delivered babies. They did not wash their hands. Nobody washed their hands. The concept that invisible particles from a dead body could be carried on human hands and transferred to a living patient did not exist yet. Germ theory would not be published for another 15 years. Semmelweis had no framework for what he was seeing. He couldn't explain bacteria. He couldn't name the mechanism. What he had was a pattern and a hypothesis. He called it cadaverous particles. In May 1847, Semmelweis introduced a new rule in Ward 1. All doctors and medical students were required to wash their hands in a chlorinated lime solution before examining any patient. The results were immediate and staggering. Within 2 months, the death rate in Ward 1 dropped from 18% to 2%. By the following year, it had fallen to 1%, lower than Ward 2 had ever achieved. Semmelweis had just performed one of the most successful public health interventions in human history. The medical establishment's response was to ignore him. Here is where the story becomes something darker than a simple medical mystery. Semmelweis presented his findings to the Vienna Medical Society. He showed them the numbers. He showed them the before and after. He showed them the death rates collapsing in real time. The senior physicians of Vienna looked at his data and rejected it. Why? Part of the resistance was scientific. Germ theory didn't exist. Semmelweis could not explain the mechanism behind his results. He could show that hand-washing worked. He could not explain why. And in a medical culture that demanded theoretical frameworks before accepting empirical results, that gap was fatal. But the deeper resistance was not scientific. It was personal. If Semmelweis was right, then the doctors of Vienna General had been killing their patients. Not through malice, not through negligence in any conventional sense, but through the simple act of walking from an autopsy table to a delivery room without washing their hands. Respected men, educated men, men who had dedicated their lives to healing. They had been killing mothers. The implications were unbearable. And so the medical establishment did what institutions have always done when confronted with an unbearable truth. They attacked the man who found it. The chief of Ward 1, Johann Klein, became Semmelweis's most powerful enemy. Klein blocked his reappointment. Semmelweis was effectively pushed out of Vienna. He moved to Budapest, where he continued his work and achieved similar results. He wrote letters to the leading obstetricians of Europe, long, increasingly desperate letters demanding they adopt handwashing protocols and stop killing their patients. The letters did not help. As the years passed and the medical establishment continued to reject his findings, Semmelweis began to change. The letters became angrier, more erratic. He started writing open letters accusing specific physicians of being murderers. He was not wrong, but he was increasingly unable to make his case in terms that the scientific community would accept. By 1865, colleagues who had once supported him began to worry about his mental state. In July 1865, Ignaz Semmelweis was committed to a mental asylum in Vienna. He was 47 years old. He died 14 days later. The official cause of death was septicemia, blood poisoning, from a wound on his hand that became infected. Some historians believe he was beaten by guards at the asylum. Others believe the wound was from a recent surgery he had performed. Either way, Ignaz Semmelweis died of the same type of infection he had spent his career trying to prevent. He died before Louis Pasteur published germ theory. He died before Joseph Lister introduced antiseptic surgical techniques. He died without recognition, without vindication, and without ever knowing that he was right. Within 20 years of his death, hand washing had become standard medical practice across the world. The mechanism he couldn't explain had been explained. The theory he couldn't articulate had been articulated. The results he couldn't get anyone to believe had been replicated 10,000 times. Semmelweis was right. He had always been right. Here is what his story actually is. It is not a story about one stubborn institution failing to accept one good idea. It is a story about the specific way that truth gets rejected when accepting it requires powerful people to admit they were wrong. The doctors of Vienna didn't need more evidence. They had the evidence. What they needed was a reason to believe the evidence wouldn't cost them their identity, their reputation, and their understanding of themselves as healers rather than killers. They never found that reason, so they found a different one. They decided Semmelweis was the problem. Every field has its Semmelweis moment, the idea that arrives before its infrastructure. The person who is right before the world is ready. The evidence that cannot be heard because hearing it would require too much from the people in the room. Semmelweis died in an asylum 14 days after he was committed, of the infection he had spent his life fighting, unrecognized, alone, and correct. The hand washing worked. It always worked. Nobody wanted to know. Like and subscribe for more history documentary video. Thanks for watching. Bye, see you guys next time.